Here's a sobering fact. According to Cancer Research UK and the American Cancer Society, 1 in 3 people will be diagnosed with cancer in their lifetime. Yet millions of these cases are diagnosed far too late, when treatment becomes significantly less effective. What's tragic is that many of these cancers gave early warning signs, subtle clues that something was wrong. If caught in time, the survival rate can be over 90%, but when diagnosis is delayed, that number can drop below 20%. This video isn't here to cause panic or paranoia. It's about awareness, backed by real data and trusted medical sources like Harvard Medical School, Mayo Clinic, and Johns Hopkins Medicine. We're going to explore 8 lesser-known early warning signs of cancer, signals your body may be giving right now. Some are easy to miss, but knowing them could be life-saving. 1. Persistent bone pain. Not just growing pains or gym soreness. Muscle soreness after a tough workout is expected, but deep, persistent bone pain, especially at night or without any clear injury, may be something more. Cancers like osteosarcoma or metastatic bone tumors often start this way. The pain tends to worsen over time, resist over-the-counter pain relief, and may be accompanied by swelling or fractures. According to the National Cancer Institute, recurring deep bone aches should always be evaluated, especially if they persist for more than 2-3 weeks. 2. Vision changes or eye discomfort. Blurry vision, flashes of light, or a dark spot on your iris. These aren't just optical annoyances. They can be signs of ocular melanoma, the most common eye cancer in adults. This rare cancer often appears in fair-skinned individuals and may go undetected until it spreads. If you notice new or worsening eye symptoms, especially a spot that changes color or shape, don't delay. Book an exam with an ophthalmologist. As Cleveland Clinic advises, digital retinal scans can detect abnormalities before symptoms become serious. 3. Unusual skin spots that don't fade or itch. Not every rash is benign. One early sign of leukemia, a blood cancer, is the appearance of petechia, small, flat, red or purple spots caused by internal bleeding under the skin. These spots typically show up on the lower legs or under tight clothing, don't fade when pressed, and may come with easy bruising or nosebleeds. According to Leukemia and Lymphoma Society, these skin signs result from low platelet counts and should not be ignored. 4. A dark stripe under your nail. A dark vertical line under your fingernail or toenail, especially if it's new or growing, could be subungual melanoma, a rare but dangerous skin cancer. Warning signs include stripe wider than 3 mm, blurred or uneven borders, pigment spreading to nearby skin, nail pain or splitting. Many people dismiss this as a bruise or fungus, but early diagnosis is crucial. If you notice any of these signs, see a dermatologist immediately. 5. Night sweats without a clear cause. We all sweat sometimes in our sleep, but if you're waking up drenched, even in a cool room, take it seriously. Persistent night sweats can be a symptom of lymphoma, a cancer of the immune system. According to Harvard Health Publishing, lymphoma-related night sweats often come with fever, fatigue, or weight loss, called B symptoms in clinical terms. If you experience these, particularly in combination, schedule a blood panel and physical exam. 6. Chronic acid reflux that doesn't go away. Occasional heartburn is common, but if it persists for weeks, even with lifestyle changes or medication, it could be a sign of esophageal cancer. Ongoing acid reflux can damage your esophagus and lead to Barrett's esophagus, a precancerous condition. Look out for difficulty swallowing, chest discomfort, unexplained weight loss. As recommended by the American Gastroenterological Association, symptoms lasting more than 3 weeks warrant an upper endoscopy. 7. Yellowing skin or eyes, jaundice. If your skin or the whites of your eyes turn yellow, it's not just liver trouble. It could be a red flag for pancreatic or liver cancer. These cancers can block the bile ducts, leading to a backup of bilirubin, which causes jaundice. Look for accompanying signs like dark urine, pale stools, or upper abdominal pain. Because the pancreas sits deep within the abdomen, early symptoms are subtle and often missed. If you notice these signs, urgent testing is advised. 8. Persistent fever with known infection. Running a mild fever for a day or two is normal, but if you're experiencing low-grade fevers over 100.4 degrees Fahrenheit, 38 degrees, for 2 weeks or more, without a known cause, it could signal something serious. Chronic fevers are a common early symptom in blood cancers like leukemia and non-Hodgkin's lymphoma. These cancers stimulate the immune system to release inflammatory proteins, which elevate body temperature and fatigue. Memorial Sloan Kettering recommends a CBC, complete blood count, and physical exam if a persistent fever comes with night sweats, fatigue, or weight loss. Early detection saves lives. Every symptom we've talked about today is based on science and shared by trusted health institutions. But the truth is, your body is the best messenger. At H-Medics, we're here to help you decode those messages with health content backed by real research. If this video helped you, hit that like button. Subscribe for daily health insights and science-backed wellness tips. Also, share this with someone who may need to see it. You could change or even save a life.